course has been an eye-opener because it's expanded my understanding of the use of clinical simulation.
The course has given me an opportunity to understand the theory behind what it is that we do, and most importantly, it has given us an opportunity to learn what best practice is when designing such a course.
But we've learned quite a lot. We have had sessions back to back during the 5 days, and it's been quite interesting to have interprofessional learning because the cadres that were within this training ranged all the way from nurses to even our administrative assistants within the hospital.
It has been a great week. We have been taught a lot of things that are useful for us as clinical educators in the space of simulation.
We're going back to revive the whole concept of simulation and how we use it to teach our clinical students at the undergraduate level and the postgraduate level to improve their learning as well as our teaching.
We have gone through all the steps from the point at which you begin identifying a topic for the simulation exercise, through assembling the resources and even planning and connecting the course with the learning objectives. Then two other critical areas that I'm very happy to have learnt about are the pre-briefing sessions and the debriefing sessions and the role that they play in helping the student to be safe, psychologically, and even in terms of how they then connect the learning activities with this particular practice.
Each and every one of us has had a take-home message in how to incorporate clinical simulation and the opportunities out there for our learners in trying to convey the different competencies and skills that we'd like for them to have in medical education. We want to see how to begin to extend our wings and broaden this training, not only in Kenya and in East Africa, but even in other countries in Africa and even beyond.
The program is a good one, and I would encourage as many people are able to join this program to do so. One, because you have an opportunity to meet clinical educators who are interested in simulation, so then you have a chance to network with fellow simulators. But then it also is one that opens up your mind on different ways that you can use simulation in education. We all know that, especially in the past 2 years, because of the constraints of COVID and having to use more and more technology in education, that simulation is becoming a methodology that a lot of people are beginning to see that they need to incorporate into their training. So this then provides an opportunity for people to build skills. And I have had an opportunity to build on the skills that I have already had and acquired in other places, but also an opportunity to see how other people are doing simulation and take ideas that I can incorporate into my clinical training.
So I'd like to encourage everyone, every medical educator out there, if you are passionate about teaching and learning within the medical education, please come and do this course so that you can improve your personal skills in simulation, and thereafter go and pass the same skills to your learners and improve their skill set, and ultimately also to the other faculty within your training facilities.